Hi there, I'm Dr. LaQuita J, and welcome to my YouTube channel where I talk about all things in between being and becoming a pharmacist. How you doing? You all right? Today in this video, I want to talk about the Naplex competency statements, and I want to go through it in the sense of you can read it just to be reading. But I really want to go through and saying if I was preparing for the Naplex exam, how would I approach this? So let's get started, okay? So these are the Naplex competency statements, and Naplex is the North American Pharmacist Licensure Exam. And this is the blueprint, and this is honestly how your Naplex score will be reported. You will get areas 1 through 6. These are 6 areas, and we'll walk through those. You get 6 areas, and then you'll go between level 1, 2, 3, and 4. So this is one of the kind of things here. So let's go into area 1. Area 1, let's just go overall. Let me just do I'll break this down. I want to make sure I say this. So area 1 is, well, let's just keep going. Like I said, area 1. So if you look at it, area 1 is 82% of the exam. Area 2 is 14% of the exam. And area 3 is 35% of the exam. Area 4 is 14%. Area 5 is 11%. And area 6 is 7%. If you look at this, area 1, area 2, and area 3, this is a lot of disease states chapters. So all the different disease states, that's majority of your exam will come from, is of those disease states. And with that, as you can see, if you calculate this here, you have 18 plus 14 plus 35. This is going to be 67% of your exam. And with calculations and compounding, that is 25% of your exam. So those are some key things you definitely want to focus on. Of course, let's not dismiss the 7%. This is like one of those things of you can really fumble the ball on the 7%. So let's not do that, okay? But area 1, obtain, interpret, or assess data, medical, or patient information. It's all about from instruments to screening tools, laboratory, genome, genetic information, things of this nature. Patient factors, practitioner factors, medical records, including like the medication history, family history, social history, allergies, social economic background, things of this nature, as well as we come into the disease states, signs, symptoms, medical conditions, risk factors, matrix health, and evidence-based. And as well as evidence-based literature for studies, primary, secondary to tertiary references. So all this here, these things, what I read, and this is what I'm reading as a Naplex prep coach, Naplex Success coach. One of the things is, if you look at this information, it's all about, this is part of the disease state chapter. When you're reading disease state, that's going to be that background information. When it tells you, it introduces you the background to the disease state. When it starts talking about the risk factors people may have, the signs and symptoms people may have. When it comes to guidelines, such as if we were studying hypertension, or if we were studying cholesterol, dyslipidemia, there'll be those particular guidelines. That these are the kind of things that you want to focus on. So when you're studying that disease states, you want to see, okay, by reviewing these things, by reviewing a patient's, disease states, the pathophysiology of the disease state. Well, yeah, pathophysiology of the disease state in a sense, more so patient factors, the background information, those things. You want to make sure you think about this is going to be area 1, potential for area 1 of the exam. Then we go into area 2. Area 2 is identify drug characteristics. This is the pharmacology, the mechanism of action. This is all about the drugs themselves and those kind of warnings and things. It's just like basically all those things about the drugs. Going from, again, indications to side effects to contraindications. Well, not really. But just most of those drug key factors, mechanism of action, pharmacology, how does it work? On the pregnancy lactation of if the patient's pregnant, is this pregnancy safe for a patient? REMS type of thing. It's like those big black box warnings kind of things. You want to know those specific characteristics, or if there's another drug that's biosimilar to it. So if you're studying for this exam, this is going to come into play where you're sitting here studying and you have a prep book and it lists all those characteristics. Those are literally, it's just the characteristics of the drugs. So that is going to be 14% of your exam. And the key thing is I always say everything, you can know all the things, but you have to think about it. When you're practicing, I know we want to know all the things, but the thing is when you're practicing, some things you're going to forget. There's this thing there are these resources called Micromedics and Lexicon and drug information that we can always look up. But it's one of those things of you want to make sure you know at least the foundational things of the particular drug. So always keep that in mind, okay? And here comes area 3. Area 3 is about developing our management treatment plans. And this is literally what it says. It's all about those therapeutic monitors, that contraindications, dose adjustments, toxicology. And the thing about this is, and this is where you get into your zone of truly thinking like a pharmacist. And this is one of those things of, yes, we can know the treatment. You can know, I would say first off, always learn a baseline that knowing the drugs, like learning the treatment, like learning the baseline treatment for every single thing. For instance, we know hypertension, right? You can use beta block, guidelines, let's do guidelines, right? For African American patients, you can use cancer channel blockers or thiazide diuretics. That's the preferred thing. Okay. Just knowing like this simple thing of baseline kind of things, right? But then you have to also think, and then you have to start thinking when you start thinking, and those adjustments, it's just like, hey, but making sure it's the most appropriate drug, the most, appropriate therapy. There are no contraindications. There are no allergies. There are no precautions that the patient may have. There are no drug-drug interactions if the patient's taking other medications. Those are the things you want to really get into your bag of thinking like a pharmacist. So that's about managing those treatment plans and really getting those different scenarios and things of this nature. So as you start studying, so if I was someone who was studying, that would come into play of not only just starting off with learning, just basically learning the different treatments, what is used for this particular patient, and what is can be recommended. And oftentimes we focus on pharmacological therapy, but please do not forget the non-pharmacological therapy as well. And it's also too having a collaborative practice type of treatment for a patient. That's always, I know we are pharmacists, but however, we are clinical. We are clinicians as well. So that's the thing of, to be mindful of that we're not just the drug treatment path of test. It's like, you are a clinician and you have to think and move like a clinician. Area 4 is calculations. And this is all the calculations combined from pharmaceutical calculations to pharmaceutical calculations mean anything from dose adjustments for, dose conversions, ratio strengths, osmolarity, ionization, to biostatistics, the epidemiology, the pharmacoeconomics calculations, pharmacokinetics calculations, those patient laboratories when it comes to certain drugs, like for cancer drugs, you have to calculate the BSA, those things, all those things come into play if you were doing the phenytoin correction, calcium correction, you were calculating insulin levels. These are all related to calculations, all the kind of calculations you would get encompassing one. And this is one of the biggest things I would truly say is 14% of your exam. This is something that I don't care what part of studying you're in, you should always dedicate a minimal 30 minutes to calculations every single day. That's my true recommendation for you if I was studying for the exam, preparing for it. At the minimum 30 minutes a day, just doing some kind of calculations because calculations can truly make or break your performance on the exam and your passing score. So be mindful of that, okay? In regards to compounding, and when it comes to, let me just go back and say this one more thing for calculations. Just practice them, because just get in the habit of practicing and solving puzzles kind of thing, because you're just not going to be prepared for the kind of math you will see. Just always just continue to practice calculations, okay? I want to make sure, go back and say that, okay? Area 5, compounding. Compound, dispense, or administer drugs or managed delivery systems. This is all about compounding, dispensing, compounding, the administering the drugs, the making of the drugs. This is all about that, and specifically the techniques and the procedures you use, non-hazardous versus hazardous. This is going to be the stability, different kind of techniques, the packaging, the storage, the handling, how you dispose certain medications, all that encompassed in compounding. And you want to make sure this is 11%. This is typically here. This is also a good compounding chapter. You're just good on it. So don't necessarily worry about, just be over that. But I'll always say this. Compounding is one of those subjects where you can read one time while you're studying a disease states. However, as you get closer to your exam date, it's highly recommended that you constantly increase the frequency of viewing compounding, because now it's the point of compound is not just a chapter like diabetes. This is actually 11% of your portion of your exam, and diabetes won't be 11% of your exam. Get what I'm saying? Okay. So make sure as time go on, you want to make sure you focus on compounding. Then you have area 6. Area 6 is develop or manage practice or medication use systems to ensure safety and quality. People love this medication safety, quality assurance. There is no particular way in preparing for this particular session. Being honest, this is more so like thinking like a clinician. This is more so scenario based. There is absolutely no particular way of doing this. So I just want to make sure, be mindful of this. And, your prep book probably have a chapter on it, which is good, but I also recommend to just going over just basic. If you're taking the MPJE, just going over basic kind of foundational things that kind of helps just a little bit with it. And I'll even say going a little bit over, you can, different things like stewardship and collaborative practice agreements and things of that nature. That will just be good. Just familiarize yourself with those kind of terms and stuff like that. But it's more scenario based, more like you can prepare. It's like when it comes to your approach with this is going to be end all be all. It's not like a way you're thinking clinically. It's kind of more black and white in this session. So just be mindful of that. And just as taking this particular document is provided by NABP, the National Association Board of Pharmacy. You can find this on nabp.pharmacy.com. So just be mindful of this. You want this resource. Currently, it says January 2021 as recording this video. 2024, it has not been updated. So just be mindful of that. This is the same one for since then. And it typically will update it every couple of years or so. So just be mindful that I want to give that disclaimer. But I do hope going over these competency statements, you do have a better, clear approach in how to prepare for and how to use it. It's almost like when you were in school your professor gave you a syllabus. Use this as your syllabus and how to approach. So I hope this was helpful. If you did, please give me a thumbs up, leave me a comment. I love to read your comments. I love to interact. Just as always, like, subscribe to our videos. Thank you for watching. And guess what? Until next time, remember that pharmacy is on limit if you are. Now go be great. Talk to you guys later.